New mothers searching for help in a world where COVID-19 is top priority, from postpartum pain to depression and now the stress of a pandemic.
The number of patients that are experiencing postpartum depression has increased since the start of the pandemic.
Medical experts say the Omicron variant is forcing hospitals to make the difficult decision once again. Who takes priority? I spoke to Somerville Women's Care OBGYN, Dr. Andrew Futterman. He tells me in 2020, at the start of the pandemic, more and more women had to adjust to their new normal, lack of attention after childbirth, and having to settle for virtual appointments.
I think we see a lot of parallels between what patients might be experiencing at home with the feelings of isolation during the pandemic, and similarly in the exam rooms or even labor and delivery floors when their significant others aren't able to be there and make them feel like they're alone.
As of late, people are confusing postpartum depression with the mental health stress of the pandemic.
About 20% of patients will have depression before their postpartum depression develops. About 40% will develop it during pregnancy, and then the rest of the 40% can develop it postpartum.
Family history, social support, financial challenges, and hormones all play a part in postpartum mental health.
I think especially maternal mental health can be very misunderstood. You know, a lot of times you hear, oh, well, you and the baby are healthy, so just sort of move on. And, you know, birth trauma, challenges with breastfeeding and sleep deprivation, all of that plays a role in our mental health.
Caroline Adams, a licensed professional counselor, says oftentimes women are left to cope with physical and emotional challenges on their own, but having a supportive partner helps.
It's such a vulnerable time and tender time, and so some of the strategies that work in your relationship now don't work with a crying baby. Having candid conversations about expectations for each other in that new role, we can't predict what that time will look like, but creating a plan around prioritizing each other's needs.
Adams works along Postpartum Support Charleston to help women adjust to motherhood.
Sharing your truth with someone who's going to understand. So if that's your partner or a friend, someone who's been through something similar, not being afraid to put what you're experiencing into words.
Now, both Counselor Adams and Dr. Futterman tell me postpartum care should not be deferred. If you or someone you know are experiencing postpartum depression, Postpartum Support Charleston has resources for you. In the studio, Amaris Jenkins, count on 2.